Great, thank you. Since I have memory, I have always been interested on social relationships, why people behave in the way that they behave. But within that, I remember always having the memory about social inequalities. Of course, growing up, I didn't know about social inequalities. But I was really struck by the different degrees of how people relate to each other and how do they discriminate against each other. And you may say, yeah, probably because you're coming from Guatemala, one of the most unequal countries of the world. Well, when I was growing up, I didn't know that Guatemala was the most unequal. That's the only thing that I knew. But I was really struck by the fact that in my case, I'm a mixed race. In Guatemala, we have about a quarter of the population are called mestizos, like in my case, but we are urban mestizos. And what is that different? The difference is that from a wave about 200 years ago, the indigenous people were pushed out from their land so they could give it to the Spanish colonizers to grow coffee. Many of them migrated to the urban areas, and they became the urban poor. They got mixed with Europeans, with Africans, and so forth. But the characteristic of the urban mestizo is that we don't know which one is our ethnic group. We didn't speak a native language anymore. We just grew up in poor urban neighborhoods. So that is the main difference when Guatemala, you see the statistics and say that 45% of the population is indigenous. Those are the ones that are very clear about who's their ethnic group. They speak the native language. But if we were to add people like myself, we easily are 95% in Guatemala. So what was for me very relevant at that time growing up is that although we were discriminated against for being poor, but that was nothing compared to the discrimination of being poor and indigenous, or poor indigenous and women, and poor indigenous women and living in a rural area. So all of that to me became I was very interested about that, seeing how my neighbors, but also some relatives would discriminate against rural people, but we're also coming from very poor backgrounds. So all these kind of relationships, I was always interested in. And when I had to go to university, then I just loved everything that had to do with social sciences. But in the end, I just decided to study psychology, specifically social psychology, because I wanted to understand this issue of social inequalities and how it's related to poverty, but also to violence and so forth. And because of the violence in Guatemala, we had a 36-year of very gross civil war. Half of my studies, I had to flee the country because, again, the political repression against the students, they started to kill the students just because they were potentially to become leaders of reformists. So at that time, it was understood socialist movement. So just by being a student, you just got killed. So I was very lucky that at that time, when the repression started, I got a scholarship to finish my studies in the US. So I finished my studies in social psychology in the US, and I returned to Guatemala with the intention of doing some research to understand the issues that I just mentioned about social inequalities, violence, and so forth. But when I returned, the war was still ongoing, not as serious as when I first left, but still only if you mentioned that you wanted to do research on violence, political violence, then you were on the really serious threat. So I had to move either to another field or to do something else because I couldn't do that. And for about 6 years, for about 6 months, when I returned, I couldn't get a job. To begin with, because I just graduated in the States, came back, I never done any work before. And secondly, because people were very worried and concerned about my situation. Because in those years, it's still the case, but in those years more importantly, whoever leaves Guatemala never come back. So you actually leaving and going to the US, how come on earth you decided to come back? So they will do you that. Something's going on with you. It doesn't sound right, your story, that you decided to come back. But I was very lucky that just by accident, there was a new project of an international NGO. It was a project on child survival that they're going to implement the project in post-conflict areas, indigenous areas, very rural. And they had the problems that they didn't want to receive the medical team. There is no communication and nothing. And the international director at that time, I don't know, he read it somewhere, but he thought that maybe a social or community psychologist can help us here. So I just saw the advert, and I said, probably at that time, I was the only social psychologist in Guatemala, because the career as such, it hasn't started in Guatemala yet. And that's how I started into public health. I wasn't aiming that. I was aiming to do more research into the field of violence, but I ended up in public health. That was the job. And when I first started, again, I didn't know how much public health, healthcare, it is related to my original interest. I wasn't aware of that. So I really fell in love with everything about it. And I made that my career, but more importantly, I learned two very important things on that first experience. First, I learned that medical providers, doctors and nurses, are very powerful actors in society. In fact, they are the most powerful. And you can see it, and nowhere is more obvious in rural settings. In rural settings, you can see that the most powerful can be the church, the school, but no one is as powerful as the doctor or the nurse there. And of course, these providers can use their power for a very good things. We just heard the marvelous stories of AJ this morning, and how the medical doctors engage with people, how the medical doctor opens the door for excluded population to be part of the system, how medical providers use their power to have empathy and solidarity with populations. So that's very powerful. But also, unfortunately, we have also the other side of the coin, which is still, sadly, is the majority situation. When the very powerful medical provider become the first barrier that any excluded or marginalized population has to navigate. When you are the first one to say no to a poor woman needing health care, or when you are the first one to abuse your power by having illegal charges, by saying, yes, but you go to my private clinic in the afternoon, I can see you there, or why don't you just borrow some money, I can see you there. So we also have the cases that those very powerful actors can be the ones that ensure that the status quo remains as it is, and also ensure that exclusion, oppression, stays as it is. So that's why I decided to pursue further studies, always with the idea of applying social sciences to this challenge of how these powerful actors and communities can work together to do social change. Because most of the time, as I'm saying, it works against it. It is the first gatekeeper for the status quo, but we have examples of being the most solidarious, also powerful person in communities. So how can we make this, instead of being the minority of practices, the majority of practice? So from that time, 25 years ago, I'm talking about my career was always with this idea that how to understand this complexity of power relations. So I was very happy and fortunate when I got your invitation to talk about community empowerment, because it's about power, which is something I've been doing from all the time. So to begin with, we need to explain what do we mean by community, which is something very important. Well, we're talking about population groups that have a shared identity. The most common idea of community is when we talk about people that have a shared geography or territory. But those are the most common, but that's not the only community. Remember, it's a shared identity. So they can have also common ethnicity, living very far apart, either because they were expelled from the original territory, but they still have a shared identity. It could be because of gender, it could be of sexual orientation, it could be because of nationality, or being migrants in another country, and many other factors. So all of these are examples of community. So when I'm talking of community, I'm not only referring to a territory, but I'm referring to this shared identity. That could be ethnicity. It could be a combination of several one of them: ethnicity, gender, and living in a specific territory. Secondly, very important, if we're talking about empowerment, what do we mean by empowerment? This discussion can be very complex, very theoretical, but it could be very simple. And I always like it to make it simple. So, and I'm sure that all of us, when we make it simple, all of us understand what we're talking about. To begin with, empowerment, we're talking about gaining power, to get more power. All of us want to have more power all the time. But then, what is power then? Well, to me it's very easy just to go to the dictionary, because the dictionary can explain to you. The two entries of the Oxford Dictionary will tell you that power is the ability to do something that you want to do or act in a particular way. And the second definition has to do with the ability to have influence. The ability. The first one is that to do like my free will, things that I want to do. And second is to have influence. If you see, it's very clear to understand what is power then. Is I do what I want to do, and secondly, I have influence on other people. I have influence on institutions. So, but very importantly, we need to also understand that this is a subjective process that involves reflection, involves self-belief, and a learning that translates into concrete actions at individual and at the collective level. So that means that no one gives power to anybody. It's only ourselves going through this subjective process that we know whether we are gaining power or not. That's why the idea that an external researcher decides what is empowerment, what's not empowerment, what is the inclusion criteria, what is the exclusion criteria, the indicator doesn't make sense, because only the people that are going through that process, to that subjective process, can decide whether they are gaining power or not. And finally, I really like the last concept which we use in our work, especially when you work with marginalized communities. If you work with marginalized communities, it doesn't help them to say, you are powerless people. For us, it's very clear that there is no powerless people as such. There is only power in latency, latent power, which is people that because of the marginalization or the social exclusion, they haven't had the opportunity to reflect, to go through this subjective process, and to become aware, to become conscious of their own power. And in many marginalized communities, what is the power coming from? It's coming from the number of people, the number of people. Unfortunately, the marginalization is always large. And secondly, the shared identity solidarity. So these reflection processes are very important to recognize their own power. Let's see. Okay, so what does it mean empowering communities? In one sentence, for us in our work, it means moving from being a passive user of services to active citizens that demand accountability. And I could tell you, what is it, but very fortunately, we just finished 2 days ago this new documentary about our work, and the community themselves are going to tell you in the next few minutes what is community empowerment.
Los servicios públicos de salud son muy importantes para nosotras y nuestras familias, pero a veces al llegar a los servicios nos encontramos con problemas, no hay medicinas o vacunas o están cerradas. Otras veces nos enfrentamos al personal en los servicios que nos discriminan por ser indígenas, campesinos o mujeres. Y también existen algunos casos en que ante una gravedad médica familiar que necesita traslado a un hospital, las autoridades de salud nos obligan a pagar por combustibles y no nos dan comprobantes. Entonces, nunca sabemos si en verdad se utiliza para eso. Y hay muchas familias que no pueden pagar el dinero que les exigen y que se quedan en sus comunidades sin recibir atención. A través de talleres y capacitaciones hemos aprendido que otros problemas y situaciones violan nuestros derechos, de que no debemos aceptar ser discriminados, que los servicios de salud tienen responsabilidades y obligaciones hacia las comunidades, de que los cobros por servicios públicos es corrupción. Para cambiar la realidad de los servicios públicos, estamos actuando como defensoras y defensores comunitarios por el derecho a la salud. Todas y todos somos voluntarios, electos por nuestras propias comunidades para educar la población sobre sus derechos y obligaciones en relación a la salud y a lo que le corresponde a los servicios públicos, recoger evidencia de los problemas que los usuarios enfrentan en los servicios públicos, defender a los usuarios cuando existen una violación a su derecho, como la falta de transporte, la exigencia de cobros, dialogar con las autoridades y planes de acción conjunto para resolver los problemas, apoyar a los servicios locales de salud para que el nivel central los asignen mejores recursos para atender a las comunidades rurales del país. Somos más de 160 defensoras y defensores presentes en 35 municipios del país que pertenecen a los departamentos de Huehuetenango, Quiché, Totonicapán, Sololá y Alta Verapaz.
Lo que yo hago es hacer vigilancias en los puestos CAP de San Sebastián. Nosotros tenemos que pagar pasaje para bajar en el pueblo, para ser atendidos en el CAP de San Sebastián. Entonces a veces no hay carro, entonces nos dificulta bastante por el mal camino. Es por eso que no llega el servicio allá en las comunidades. En mi caserío murió una madre por dar a luz y como ahí no llega la ambulancia, sí llega la ambulancia, pero uno tiene que pagar el combustible y con el mal camino que está, entonces y la gente no paga, aunque se puede conseguir carro, pero como la gente no tiene dinero para pagar un viaje de la casa para el puesto de salud, entonces mucha gente se muere.
Según la experiencia que yo tengo, incluso he vivido con mi propia familia y otras familias de diferentes comunidades, es que cuando uno va en busca de ayuda en el centro de salud, pues hemos encontrado a veces no nos responden o no nos platican en nuestro propio idioma mam, sino que más es el castellano. Entonces la gente a veces no solo con el dolor de la enfermedad que lleva, siempre y cuando necesita que lo escuchen. En otros casos pues a veces no son atendidos por lo mismo de que dicen que no hay medicamentos, solo dan una receta a veces recomiendan a la gente en un centro ya privado, cosa que no pueden hacer porque no tienen recursos económicos.
Empezamos poco a poco a saber cuál es el derecho, ¿verdad? Porque nosotros como gente, pues la mera verdad es que nos da miedo a pedir lo que de verdad es nuestro derecho, ¿verdad? Ahí me di cuenta que sí, es un trabajo, es necesario hacer, porque si nosotros no luchamos por nuestra gente, nunca no podemos, o sea, animar a nuestra gente y nosotros no podemos apoyar a nuestra gente.
Hay veces que no nos hacen caso, ¿verdad? ¿Y ustedes quiénes son? ¿Por qué vienen? Nosotros no necesitamos que nos vigilen, nosotros sabemos nuestro trabajo y nos dicen, ¿verdad? Pero nosotros, ¿verdad? Los que nos animaron son las personas que que lleguen a consulten en los puestos de salud. Hay veces que no los atienden bien, no los tomen en cuenta, espero mucho tiempo, pero ahora, cuando ya conocimos nuestros derechos y todo, gracias a Dios, ¿verdad? Todos los trabajadores de la salud nos respetan, nos llaman por cualquier cosa, por cualquier problema hay en los puestos de salud. Nos llaman para solucionar todos. Tal vez nosotros no solucionamos todo, pero por medio de nuestros alcaldes comunales, ellos son los que nos apoyan para solucionar cualquier problema de la salud.
El valor que tiene la vigilancia que efectúan los vigilantes para los servicios de salud es poder tener de primera mano información sobre la forma que se están prestando los servicios de salud desde el punto de vista de la población. Creemos que es sumamente valioso para nosotros porque nos permite en algún momento hacer las correcciones para prestar un mejor servicio y que la población tenga la confianza de que va a ser bien atendida dentro de nuestras unidades. Entonces es necesario involucrar también a las autoridades locales para que ellos asuman la parte de la responsabilidad que les corresponde, y esto se logra de una manera más fluida si tenemos a la organización, a los vigilantes, que ellos sirven como enlace para que sensibilizar también a estas autoridades para que trabajen con nosotros y que al final de cuentas se logre beneficiar a la población.
Yo quisiera informar también que en nuestros pueblos y en los departamentos y a nivel nacional, no solo ahí necesitamos el mejor servicio de salud, sino que también en las áreas rurales, donde están muy lejanos de nuestro país, que también hay una necesidad más en cuanto al personal de salud, medicamentos, pero también al mismo tiempo necesitamos infraestructura para poder mejorar el servicio de salud. Como defensoras y defensores buscamos continuar con el diálogo y trabajo conjunto con los servicios locales de salud para poder resolver los problemas estructurales que afectan el acceso a los servicios de la población. Nosotros pensamos que si logramos resolver los problemas estructurales, todas las comunidades rurales se van a beneficiar, aun aquellas donde no existen defensoras o defensores comunitarios. Entonces, nuestra meta es nuestro compromiso y trabajo voluntario beneficia a la mayor cantidad de la población posible. También estamos forjando colaboración con otras organizaciones del Estado, como la Procuraduría de Derechos Humanos, para solucionar los problemas y defender nuestros derechos en una forma integral.
Great, thank you. Did you manage to read the subtitles at the back? Is it possible? Great, okay. Because as I'm saying, we just finished it 2 days ago, and just see if it's working, if the size of the text is still right. Great. Okay, so just to summarize the key issues that came from that video. Secondly is, what does it mean community-led accountability? It means independent and autonomous citizen action. So it means it's not an NGO project that put community to do because it's a free project. It's the community themselves become aware that this is the service that we use. That's why we need to improve. The NGOs play a very important role in providing technical assistance, some resources, but it's not led by the NGOs. It's not led by government. It's led by the community themselves. Secondly, it's very important to use the existing legal framework. What the law says, what is your entitlement, and so forth. It's very important because in these power relation issues, the best allied or marginalized communities is the law, what the law says, what the entitlements are. Thirdly, this process of community leading, it doesn't happen out of the blue. It's a very intense process of raising community awareness through rights literacy campaigns. These communities, we have supported them to use community radio, they use community assemblies, many different processes to educate their own communities about the rights, responsibilities, and so forth. And also to develop skills to monitor what the services are providing and why they should be providing and why they are not working. And finally, very important to use strategic advocacy. Why? Because as we have been mentioning, some powerful actors are good gatekeepers that offer an entry door for they to engage with the system, but many of them are the gatekeepers to keep the door closed. So that's why you need to use strategic advocacy, which means if I am confronted with a gatekeeper which is maintaining the status quo, he or she is not going to let me in. So I need to use either the parliament or I need to use the judiciary system. I need to understand in this condition what I need to use from the other different institutions of check and balances in government and the state to continue engaging with the system. Next, I already say is community defenders are also that they are the user of public services, and this is very important, the issue of legitimacy. We have done this work for 12 years, and one of the most important lessons is that for any decision makers, in our experience, the most important issue that's going to drive change is not really evidence, it's not really rigorous evidence, but it's whether he or she perceives you as a legitimate actor to bring them problems. And I'm saying problem because most of them think about problems. They want to know everything goes fine. If you bring in that there's a problem with the service, there's an issue, you bring in problems. And they immediately try to identify what is your motives behind you bringing problems. If you work for an NGO, the NGOs only bringing problems. If you're an academic, academics just want to publish papers. They have no idea about public services. So it's very easy for them to push you away. But when you are a community member that uses the services, that you're not being paid by an NGO, that you're not doing research, it's only that is the service that you and your family use, then policymakers, decision-making politicians listen to you. Of course, some of them still will avoid it, but they do not have the arguments to push you away as easily as they do with academics or with NGO workers, because that's the service that you use. And in many cases, they have more legitimacy than the policymaker. Why? Because in most countries, the Minister of Health doesn't use public services. They are in so bad shape that they don't dare to use them. They use private services. And they have never used the private service. Maybe they got some training in the public system, but they and the family, they never use public services. They go to private schools as well, if we're talking of education. So that's why they have the legitimacy of saying we have to be part of the decision making because we are the ones using the service. So this is a very powerful argument when they are engaging with these gatekeepers that want to keep the door closed. Okay, what is more importantly as well is to use technology with these social mobilization efforts. In our case, we use ICT technology, mostly SMS messages, to report from very rural facilities. This is an internet-based geo-reference map in which community defenders use a coded system to send 23 different complaints about the different issues happening in very rural facilities. You can see here very rapidly, and in yellow you can see the most common complaints that has to do with the lack of vaccine, lack of drugs, and charging illegal charges, and also services are not available in the local language, despite the law saying that whenever there is a majority of indigenous population, all public service should be provided in the local language, and so forth. But this is a very important message. Every time that I engage with presenting this community-led accountability, there will always be some people that have the idea that community-led work is very much local, only works at the local level. So it doesn't offer response, which it makes sense because there is so much community engagement. So you may have the impression that it's just local work. I'm interested in scaling up. I'm interested in the big thing. But our experience of 12 years, it says that yes, it starts as a very local work, but as the community becomes empowered and knowledgeable about public services and public policy, they want to resolve the problems for good. They want to tackle the structural determinants of the problems. So a bottom-up process start to tackle the structural causes. And I'm just going to give you an example, recent example now. In Guatemala, these communities that you saw in the video have an alliance with investigative journalists to address the issue of illegal charges for emergency transport in rural areas. And I'm going to explain to you very rapidly how it happened. In this platform that I mentioned before, through SMS messages, about 2.5 years ago, by then we had over 100 individual complaints of people that were forced to pay illegal charges so they could use the ambulance, the government ambulance. The driver is somebody that needs immediately care. It has a referral order. Still, the driver or the doctor didn't want to refer unless there was a payment. So we had over 100 individual complaints. They were brought to authorities, and authorities always say, it's isolated cases. We're going to investigate. And again, there's another complaint. It's an isolated case. Probably we're not doing very good with administration. We're going to sort it out. But for the families, it was a very serious thing. Many of them were in serious debt to pay for these illegal charges. So together with communities, we decided, how can we do to move through these gatekeepers of the bad, the gatekeepers of the status quo, that are saying, there's isolated cases, we're going to solve it. How can we move and go to the very top level, because we are not moving through? So we decided, why don't we give all this information to investigative journalists? Not the journalists that write the news, but those that do investigations about corruption, power abuse, and so forth. So that was the strategy. We provided all the information to very well-known journalists in Guatemala and said, look, these are the complaints, and we think there is a serious case of corruption that the government is ignoring. And we want you to check the information and to decide whether you have a case there, because we want to move there. So the journalists, because they are investigative journalists, they said, well, first we need to verify that all your information is actually accurate, because we cannot do an investigation if the information is made. So they went to the very rural areas to do random investigation of the complaints, and they say everything is, we verify, everything is real information. And we think it's a serious case here of corruption, because if you have already reported and they have done nothing about it, so we're going to do the report. So they went 3 months to the field to pick in different stories, and they wrote a 10-page report that was published in the second most important newspaper in Guatemala. That's the photo of the report. Based on the information of the community defenders, that was the base to build this base case study. As a result of this case study, we managed to go all the way. We have calls of the national level. They wanted to see what's going on to resolve it. But more importantly, we wanted to reach the Human Rights Commissioner, because we thought this is a case that needs to expand to solve it. And after reading the report, the Ombudsman, the National Commissioner, did their own investigation. They went to the field again to verify also the information that the journalist is saying. And if you can see there, this became a very central feature of the report about communities in a lake, that the only way to go in now is through an ambulance, which is a boat, works an ambulance. But somebody stole the engine of the boat. And the government, instead of investigating, the Ministry of Health just hid it somewhere. So this is the photo showing the blue vest belongs to the National Human Rights Commission, where they're investigating. And as a result of this process, the Human Rights Commissioner verifying the information. Now we started a planning process with the national level of Human Rights Ombudsman. We have a monthly meetings, and there is a case ongoing of investigation expanding different areas of the country. And also, in addition to that, even the United Nations High Commission on Human Rights is involved, because they say that this is very clear a systematic and a structural case of discrimination against the rural indigenous population. Because although these complaints of corruption, nothing has been done about it, and some of the discussion now is whether there is a chance of doing some strategic litigation about how the government is not responding to this systemic feature. So this is an example of how something that is very local moved all the way, and now we're talking about national level policies that will benefit all the rural areas. And because the strategy worked very well, it is expanding. Our next report was about the situation of healthcare providers discriminating against traditional birth attendants, and how it is affecting the trust of the rural indigenous women don't want to become to the services because they trust the traditional birth attendant. And if they are refused, they say, I'm not going to the services then. So that's another report, another 10-page report that was published about 6 months ago. Okay, my next example is about how doing also research can be an opportunity for also empowering communities. This is based on our report that came at the beginning of this year, which is 10 years on reflection about how can you involve communities and get the response from authorities by doing research. And very basically is comparing, when we started doing this work 12 years ago, we started with the idea that the most rigorous the evidence, the higher the chance that the decision making is going to react to that, to these problems in the facilities. So we started with doing surveys, randomized surveys of healthcare facilities. As you can see on the table, there were written reports, but we were aiming for community participation. There was nothing because, I mean, randomized surveys of 150 questions, no way they could participate. But we thought, okay, but authorities are going to respond to that because it's rigorous evidence. We had no response. They were not interested in that. They said, that's not relevant to us. Nothing. Then we move into doing more like tracers, shorter surveys. There was some participation of communities members, especially those ones that have a good enough education, but still the response was minimal from the authorities. From that experience, we learned that the problem was that these were still very much academic, and the authorities, it seems like they were not going to be willing to respond to this evidence based on how rigorous it is not, but based on who is the informer and who is supporting this evidence. So we changed completely the idea and say, instead of continuing trying to do a rigorous academic evidence, why don't we move to do that is still rigorous, but more important, who has control of it? So the community will have control of the methods. The community will collect the information, they will analyze it, and they will deliver the report themselves. So it was like a switching around the situation. And something extremely important happened. We started to see a high level of community participation because, of course, they understand very well audiovisual evidence. It was about photography and video. And also the authorities started to respond, a high responsiveness to that evidence. Why? Again, as I said, because of the legitimacy. And also the information could be verified. They could verify the photography and the video and so forth. So we came up with this graph, which summarizes our 12 years of experience. And here we have the academic complexity of the methods, from very complex, high complexity to low. Here we have the level of community engagement from nothing to more, and we have the responsiveness from authorities, from nothing to high, and we have the different years that we use different methods. As you can see, when you start with very academic complex, this is very complex, but it comes down in terms of level of engagement. There is nothing here, but it gets more and more engagement as it becomes less and less complex. And also you can see the responsiveness of the authorities increases, not with the academic complexity, but with the level of community engagement. The more participation of communities, the more responsive the authorities become to it. Okay. We discussed some more of these 12 years in these two recent publications that you can check. Both of them are open access, so you can just download them and pay nothing about it. We ensure that they are published as open access. And my final remarks. What we are seeing is that medical workforce can use their power, as I say, to promote equity, fairness, and justice. I already mentioned the great example we have. All of us know the good example. This morning, again, AJET was a very good example for that. And our experience is that an alliance of health workforce and communities can generate bottom-up accountability and social change, not only social change, but it is a major challenge. Why? Because those powers at the top, I'm talking of the medical profession, I'm talking of the medical colleges, the medical industry, and also co-opted workers' union, which we have all of those as well, they don't want this kind of change. They want to maintain the status quo. So 2 years ago, we had a very progressive minister, and she ordered that this experience that we have should be all over the country. She said, that should be all over the country. You're actually implementing the law, and we are not, you're helping us. And after a year, we couldn't do it because the whole middle management, including the medical colleges, including the workers' union, opposed to it. For them, it would be losing control and giving the control to the communities. And they opposed to it. So, colleagues, I think the work that you're doing as the muster, as the net, is extremely important. It's extremely important. And I'm very happy every time that I'm invited to this meeting because it's extremely important what you're trying to do. And I'm convinced that it is possible to do bottom-up accountability. It's possible to bring social change in this alliance of the health workforce with progressive actors. However, we have to be aware that it is a major task. It is a major challenge because those ones in the top are the gatekeepers of the status quo. And the broader our alliances, like an alliance with journalists that I just showed, that in my view, I haven't heard talking about journalism here, the more important. So we should start thinking, the net and the master should start thinking about how can we use investigative journalists as well to the cause of socially accountable medical education. Thank you.
Thank you very much, Walter. That's an amazing story. I'm just so excited and interested to hear about the community defenders. I'd like to open the floor for questions, if you're happy with that, Walter. I think we've got some roving mics, but perhaps while people are thinking and raising their hands, I'm interested in how people were found and started to be engaged as community defenders. I can imagine that it is quite a big task for somebody to move from an uninterested community member to an interested community member to a community defender.
Yes, that's a great question because two things that we learned is that we thought the beginning has to do with the content, but it had nothing to do with the content. It had to do first with who is facilitating this. For instance, at the beginning, it was us, the urban, internationally trained. At that time when we started, all of us had our PhD abroad and all of that, going into rural areas. And they were very polite. They would listen to it, but at some point they said, listen, stop wasting your time. You live there. You have never lived in the rural area. So we'll politely listen to you, but you don't have no idea what it is to live here and what kind of challenges we are facing. So that's when we understood that it is not us because we do not have the legitimacy to do that. So that's when we started recruiting other indigenous people that had formal training, but they were leaders themselves. So that was much easier for them to believe the story, the possibility of organizing to do monitoring if that comes from another indigenous person that has done it himself or herself, and also that he still lives in rural areas. And more importantly, it has nothing to do with health because most of the people that we recruited never work in health, but they work in sanitation, they work in education and gender equity, which all of those topics are related because these communities face all these issues as well. So more importantly, the experience of organizing and bringing social change rather than just health knowledge. Yeah.
Is there other question? Janine, can I?
Sorry, I've got the mic just now.
Sorry.
Just here. Hi. I'm Tas from Curtin Medical School. I just want to say congratulations on the fantastic work that you're doing. My question is, So you mentioned the medical profession, there's backlash from the top of the medical colleges and the professions against community empowerment in healthcare. What are some examples of this pushback or backlash that you've gotten from the establishment?
Yes, one example is this one that I mentioned. We thought that when we managed to convince the minister, then we're going to resolve it. And we managed 2 years ago. The minister gave the order that this should be done all over the country, and we should help with the technical team to do it. That's when we learned what I saw in some of the countries, which the minister doesn't have all the power. The power is the middle-level management, because they are the ones to implement the policies. And they can actually oppose to it by pretending that they are implementing it, but actually they are working against that policy. So it's not sufficient to be at the top or at the bottom. We need to do something about that mid-level management. And the second backlash is in one of the municipalities where we work, this community got so empowered, so knowledgeable about public service that they started to identify corruption. For instance, the medical doctor was hiring friends and charging money to the friends for that. And they were able to read the budgets, all of that. So when they started to ask questions about why are you doing these actions, the medical doctor made a funny case, a fake case about threats from this community leader, a woman, and is suing the community leader as a penal case. So we had to put lawyers because they just invented the witnesses and so forth. So one of the backlash when they start seeing that they're losing the power, which is the power of corruption, is using themselves, the judicial systems, to make false cases and false accusations against community leaders. So we know that we're going to continue confronting this, but the community leaders say, we are going to go all the way through. If you are behind us, you say that you're going to provide with legal assistance, we will continue doing it. Otherwise, we will not change things. So yes, these are two examples of the backlash.
You've got the microphone up there. And then there's Janine, I think, had it now, Janine, and then...
I've got the talking stick.
Yay.
So it's Janine here, Walter. Fantastic talk. Thanks very much. And I'm really curious about, like, the flip side of the question that you just had. How can we empower students to be involved as this sort of in this social action? How could medical students have a legitimate role in this, or health professional students actually? And how could we create the community of defenders to be actually a course or a program that is offered through universities, so that universities are fulfilling the social contract that we know that they're all failing at the moment, even though we're trying to fight that trend?
Yes, that's what I say, that you as at the Monster and at the Net are doing an excellent initiative, because in our experience, the living experience of going and living in rural areas or engaging with these people not as somebody that you need to vaccinate, or as a woman that brings a child, but to understand the life of these people, the challenges, it changes the students or the doctors or the nurses' life. So what I heard, what I gathered from you, is that the experience that most of you have of having some time going to live in the rural areas and get to know the people. I think that's one of the examples that can happen. Secondly, would be very important is to understand that, as I mentioned, is that you do not empower anybody, but facilitate the conditions for them to have access to information, access to knowledge, and so forth. For instance, in many cases, it doesn't take anything but you provided support for them to speak for themselves. For instance, we never speak for them. What we do is we provide the financial support for transport and food, so they can travel for 3 days to meet up with the authority that they need to meet up. So for instance, you could do that. For instance, when we started, we didn't have money. We just put money from our own pocket together, saying, for us it would be easy just to talk to the minister, but that doesn't make sense. So why don't we put the money together to pay the food and transport of this community leader for he or she to come and talk to them. So just to do that kind of thing creates a lot of difference when you provide the conditions for people to speak for themselves, rather than you saying, okay, it's easy for me, I'm going to speak on your behalf. That could make a lot of change.
Thank you. I've really enjoyed that. My question kind of follows on a bit from Janine's, and that graph you showed about community engagement, the minister's response, and the academic complexity totally fascinated me, because in a lot of ways, as academics, we sort of think, oh, the more fancy and complex something is, the better the results are going to be. But we kind of forget that sometimes the simple stuff is what gets the results. Did you actually see a point in there where you suddenly realised it's actually reproducible, easily understandable information that you're providing to the minister, or that, as you say, that middle level management who actually controls everything that we forget about, that you suddenly said, okay, this is the level we've got to aim for, because if we don't, we're not going to get anywhere?
Yes, two things that we need to see here. First is that we're not talking about a clinical trial for a new drug. We're talking about improving the delivery of services, which in practice, it is a power relation situation. Whether you decide to improve something that is not doing wrong, or whether you decide that you want to do things differently. So in this context of this kind of evidence, authorities, people get moved not by how rigorous is your data, but again, the legitimacy of the actor, and what is the mobilization behind that they need to respond. And when you found, as you're saying, the declarative information, that is crucial, but that's crucial most for the community, because they need to know what they are going to bring and defend their arguments at the authorities. But because of the training they have received, they can explain and relate very well a service that is delivering with faults in the public budget, that is not working, and so forth. So they also bring with the arguments and the solutions. So that part is very important, not only to collect evidence about what is not working, but already have an argument about what is the solution. And that's very important, to come out of those meetings with an action plan. For them, it's very important not to have a meeting and just come in empty-handed. There has to be an action plan, or at least a commitment to a next meeting for an action plan. Because authorities can be, yes, you're very good, thank you for the information, but nothing happens. So the importance of actionable evidence. Yeah, thank you. Thank you. Thank you. Thank you.
Walter, I really want to thank you for this session. I think you've helped to demonstrate the journey of the community defenders, and perhaps have been a little modest about the trust relationship that exists between you and the university in the support of the community defenders in order to empower them. We thank you for sharing our story, and we really appreciate what you're doing for your country.
Yeah, thank you. Thank you.